G'day guys, it's Jason Darcy here. Today we're going through a classic lower back treatment. So if you've got lower back pain from sitting down or working as a tradie or whatever it might be, this is the treatment that if you've got that pain, this is what we'll do for you. Yeah. Alright, so if you're new to our channel, like and subscribe as we do lots of treatment content, but also exercise, rehabilitation, personal training, strength and rehab. So yeah, follow along if you're keen to get out of pain or if you want to improve your overall health and fitness. Yeah, nice. So yeah, we're starting our lower back spot with our palm right on the sacrum. So this is where we want to start our treatment. So we're just connecting in with the fascia that crosses over the sacrum there. So just putting your palm straight down and pushing down towards the table. So we're sinking in and straight away we're making a good connection with that sacrum. And we're just holding. So not moving straight away, we just want to hold, sink in and see how it feels through there. And feels so this good. For a lot of people just feels so good straight away to have a bit of pressure through there and you're just sort of mobilizing this area, releasing some of that fascial tension around the area.
Feels good, man. Feels connected, feels relevant, feels really nice.
Yeah. And if you're suffering lower back pain, you know this. You're probably watching this going, oh, that'll feel really good just to have that spot connected with. You've probably never had your sacrum treated. As a lot of people just think it's a bone that's there in your body, but yeah, there's quite a lot of fascia that covers it and muscles that obviously connect into that area. So yeah, it has such an important role with helping correct lower back pain or hip pain or anything around that sort of pelvis region.
And of course, we need the mobility in our SI joint as well.
That's right, yeah. If you're locked up through your SIJ, you're not going to have good movement around that area. That can contribute to lower back pain. And then once we've sunk in, we can start to sort of explore out. So maybe just come around this side, Leo, so you can see. So now I'm starting to move out towards sort of the glute.
Oh, yeah.
So just slowly dragging out. And then we'll just drop off the edge of the sacrum there, and we start to hit into those glute tendons that are attaching around the top of the iliac crest, so just around through here.
Oh, yep.
And so it's just a nice way to also warm up that area around the lower back. So do a couple of strokes through there, and then we can also do one connecting in, and this time we're sort of moving down through that sacrum. Move that way. Yeah. Once we've done those, we'll get the watch out of the way. Sorry guys, should have had that off earlier. There we go. All right, now we move into our lower back money spot. So this is our key spot that we go to. And almost everyone that's come in with lower back pain, they know this spot is what they need. So our lumbar spine meets our sacrum right in here. So we want to sink in just beside the spine there. So we're not on the spine, we're just right in beside it. And then we're going to either angle down this way, or we can explore out that way. All right. So to locate, we can start with our elbow. As I've treated Darcy a few times before, so I know what I can sort of sink in and get to the level with him. But if it's a new client, I would do a few warm-up strokes through there with my palm. But we can start quite broad, and we're just slowly sinking in there. Just staying in that one spot. We're not moving. And we can just stay at that superficial level to start with. Just slowly allowing the client to sort of accept that pressure. And yeah, if you haven't had this spot treated, you might be a bit like shocked by it, but it is the spot that carries so much pain for a lot of people. How does it feel there, Darcy, in that spot there?
Just really good, man. Yeah, I've been getting a little bit of tightness in my lower back just from training and running and football and gym and work.
Yeah.
So it's needed it, man. I can just feel a little bit of associated pain going down into my glute. And
yeah, so you can get some referral pain that travels down into the glute, so it might be like an aching pain, or sometimes it's like a neural, nervy type sensation. Yeah. Sometimes it can wrap around into the front of the hip. There's multiple sort of referral pains that you can get from this area. So if you're suffering sciatica or have any sort of referral into the hamstring and calf, sometimes it can be coming from this spot in the lower back as well. Yep. And so we're just staying in that spot, and as you can probably see there, I'm just starting to move around a little bit. So I'm not actually moving out on the muscle, I'm just changing my angles in that same spot. So it might not look like a lot on the camera, but underneath it feels like so different. Just I can push back down more in that way towards the sacrum or the iliac crest, or I can angle across. Almost now I'm pulling back towards his opposite glute. So we're just exploring that one spot to start with, staying connected and trying to connect with your pain. So where you really feel the majority of your pain comes from. And then once we hit it, we stay on it and we wait. So yeah, we can spend up to 10 minutes in one spot just exploring different angles. There's no cookie cutter approach to treating this. We just go with what the person needs. So if it needs to be held, if you've had that chronic pain for 10 years, then yeah, just doing a couple of strokes through there and then moving on and sticking to a routine isn't going to help it. So we've got to give it the attention that it needs. And then yeah, once we feel like we've started to really connect in and it started to release and soften, then we can start to move out. So now I'm starting to trace around the top of this iliac crest. So we'll cross over those lumbar erectors. And then our second money spot is just on the outside of the erector spinae, which is that muscle running down the back that you can see on most people. So we hook in there, and we're sort of getting into QL under there. So some people, this spot can be their spot of their pain. And again, you can get some referral pain from here, or it can just be localized.
Oh, that's good out there, man. That goes more into my quad.
Yeah, yeah.
Bloody good.
And again, we can hook and connect in with this spot. And then once we feel it releases, we can slowly start to move through it again. Working our way around. And always getting feedback from the person on the table that it is good, productive pain. So it might be a bit uncomfortable, but we want it to sort of be that 7 or 8 out of 10 where it's, yeah, a bit uncomfortable, but you know it's doing good. It's that therapeutic pain. It's not traumatic, and it's not feeling like it's aggravating the issue.
Yeah.
So once we've done that one, we can do a couple going up the spine here. So this can help to really decompress this lower back. If you're someone that's stuck in like an anterior pelvic tilt, or these lower back muscles are just really jacked and hypertonic, then this one can really help to lengthen everything out. And yeah, this after doing this one, some people feel like they get a bit taller, can stand upright a bit more.
Oh, yes.
So we'll see if we can make Darcy 6 foot after this
Yeah,
one.
that'd be nice. They're doing that surgery on people's shins. People
Are
getting.
they add in a bit of extra bone, do they? Or what do they add in?
I don't know what the hell they're doing, but it's crazy.
Metallic plate or something.
They're like adding like 4 inches to people's height. Like,
Right.
I don't know, breaking their shin bones, their tibia, and
That's crazy, isn't it?
yeah, crazy. I'm thinking about it.
That's crazy, but I've done it already. So yeah, this one we're connected in with the laminar groove, so that groove beside your spine. So this is the erector spinae muscle that I was talking about before, so we want to be on the inside of that. So as you can see, that's Darcy's spine there, so I want to be in this groove right here. So we're hitting all those muscles that connect deep into the spine there.
Oh, yep. That's fun.
And we can also provide a bit of counter strain, so this will help to sort of get a bit of a fascial stretch through there as well, just by pulling down on the fascia on the glute there. Just helps to lengthen. We can even start to just provide a little bit of like a mobilization as well. Get a little bit of movement through the back. Sometimes you might get a little click in there. We can take that all the way up into that thoracic spine.
So therapeutic. Oh.
Yeah, this one feels really good when you're on the receiving side.
Yeah.
So I'm keeping my pressure at that same level. You can see I'm doing these little wiggles just to see if there's anything that needs to be loosened up through there. And then we can hit that one with the elbow as well. So sink in that same spot. So I start on top of the sacrum. So I pick up the slack in the skin and the fascia on Darcy's body and my own. And then we can just slowly drop in to that money spot. So we're hitting the money spot from a different angle here. But then instead of working around the iliac crest, we're going to work up the spine. And again, staying in that laminar groove.
Oh, yep.
And it's nice and slow.
Yeah, it's good.
The reason we go slow is so that we're allowing the person to accept the depth of the treatment. Because it is quite deep, if we go really fast, some people guard up and protect because it's a natural instinct. If you think it's a threatening thing, because, yeah, if you haven't had deep body work before, it does feel quite intense. So that's the reason we go really slow, as opposed to what you might have seen previous sort of medial massages from other practitioners. They might go quite fast, or it might look like a bit of a sports massage. But yeah, this is to sort of allow that connection with the client, and we can get to that depth where we can truly get a good result.
Oh, that feels good, man.
All right, let's move on to the other side.
Yeah,
so
balance me out a bit.
Once we've explored around there, yeah, we can do a little bit more through the QL, but yeah, for the video's sake, we're going to move on and show you the other side as well, so we even the person out.
Yeah. It's important, isn't it, man, when you do the sacrum stuff?
Yeah, absolutely.
Just to have like more equilibrium, more balance.
Yeah.
Alignment is probably a good word.
Yeah.
Yeah.
So yeah, if your pain is more on one side, we will focus on that side, but we still want to do a little bit on the opposing side, just because there can be some compensation, and we don't want you leaving really feeling lopsided, and one side feels really clean and the other side feels, yeah, feels tight. Again, working through that sacrum, slowly moving out, connecting into those glute tendons.
Oh, yeah. Oh, just the pressure on that sacrum, just like that, just
Even that just feels soothing, doesn't it?
Soothing, exactly, good word. It's just relief straight away.
And as a practitioner, if you're someone that's wanting to learn this sort of stuff, there is a mentorship program where you can learn off Ninja and Aaron. So yeah, what we're doing here is by having the table quite low, it might seem different for what you've previously been trained, but this allows us to just be able to use my body weight. So for me, unfortunately, I'm not 6 foot and I haven't had the surgery to make myself 6 foot. So having the table quite low, this makes the treatment quite easy for me. I can just sit here, use my body weight, so I'm dropping in. And then if I need to apply any pressure, I can use my opposite hand and then apply a bit more force that way. Yeah. But if I've got the table up here, then I have to use all my strength to treat and produce the same amount of pressure. So it's a lot more taxing on my body if the table's really high. And this way I can sort of move through my hips, I can lean over, I can drop. And because I've worked and built up strength in the gym and everything like that, you need to have good postural awareness when you're doing this, as if you're just hunched over, then you can, cause fatigue and get aggravations in your own body. But yeah, you want to be able to apply as much pressure as you can for as long as you can. Like we do, sometimes we treat 12 people in a day and they're hour appointments or 90 minutes or 45. So if you're treating 12 people back to back to back to back, you need to be able to sustain the same pressure from the first person to the last person. So this is the way that you can do that. So now we're into that lower back money spot again. So with the palm this time. So yeah, just beside the spine, sinking in. And then with this hand, if I want to hook back and angle more towards the opposite glute, I can sort of push back into it. Oh. And so the difference from that, so then if I release and now I'm pushing more straight down towards the table, or if I go this way, I'm now just pushing more towards the same side glute. Which one feels more relevant for you, Darcy?
First one.
That one back there, yeah.
Oh.
And so we're tuning into not only what Darcy's telling us, but what feedback we're getting from the body. So yeah, as I do pull back in there, it feels like there's more resistance in the tissue from my point of view. So I want to connect in with that and hold that and wait until that melts or softens under my pressure. And then we can start to move it away. So now you can see, come in real close here, Leo. So I'm angled back that way, and now I start to pick up the slack and perform almost like a scoop where we're moving that tissue away. So trying to clear it away from where it's stuck in close into that money spot and working it way around there. And let's show you again with the elbow. So we find our spot, sink the elbow in, and then I can lean over and hook back into that spot.
Oh.
And again, this is quite comfortable. I'm hinged over through my hips, so there's no pressure on my lower back here. It's quite easy to hold. Obviously, you have to build up a bit of strength and stability in your own shoulder, but that comes with treating people. And yeah, you might have to put some time into the gym. And then we just hold. Couple of deep breaths there, Dar. So we just want the person to try and breathe into it, relax as much as they can. The instinct can to be guard and yeah, hold on to your breath, but we want the person to try and relax as much as possible. And then we can start to move around that iliac crest again.
Wow. Oh, it's good. Wow.
Sink out really slow as well. That's the other important thing that I probably didn't mention is we want to sink in really slow. So here, if I'm going up the spine, so we're sinking in, connecting in, but then when we've finished our stroke, we also want to sink out really slowly as well. So as I'm coming up here, so for instance, while you're there, if I was to finish the stroke here, if I'd been sitting there for a couple of minutes, we want to slowly release out. So we're not just taking the pressure away, so we want to slowly release out like that. So again, that's to prevent the person from guarding. If you've been in quite deep and you just all of a sudden release, sometimes that causes people to guard and almost like spasm up just to sort of protect that area. So that's another important thing if you are a practitioner. If you're going deep, yeah, the sink in is important, but the sink out is just as important. And it just makes it feel like a much nicer experience, doesn't it, Darcy?
Way better. It's so good. All the tricks of the trade, giving them away. Good. Oh.
So yeah, if you're suffering pain, lower back pain, come in, book an appointment with us.
Yep.
Or if you're overseas, yeah, we do have Fix It Yourself programs. We've got online fitness courses. Our Fundamentals of Fitness has the Fix It Yourself program in there, and then it has an 8-week training course where you can build yourself up. So we start off as workouts, individual workouts in the week. So there's 4 workouts a week. And we start off building up your core strength, your glute strength, everything like that. Then we get into more deadlifts and squats and our functional training style. And then it also, by the 8 weeks, we get you in, doing loaded deadlifts, loaded squats, and functional strength circuits as well. So that can be a really good tool that you can access if you don't have the ability to come and see us in person.
Oh.
So we'll finish that one off there. So there it is. Thanks for watching today, guys. But yeah, as I said, like and subscribe for more treatment content. See you next time. Thank you.
Done. Oh, that was